Hello, we are Luke and Ohm, and we are pleased to present our presentation on the impact of Rezum on BPH at the Medical College of Georgia. We have no financial disclosures nor any conflict of interests. We would like to thank Dr. Santamaria, who helped this project become a reality, and most importantly, we would like to thank our patients for trusting us with their care. Because Rezum is a procedure used to treat the consequences of benign prostatic hyperplasia, it is important to be familiar with BPH. BPH is not a malignancy. Rather, it is the hyperplastic growth of the epithelial and fibromuscular tissues of the transition zone and periurethral area. This area surrounds the urethra and is the cause for downstream urinary dysfunction, such as weak stream, hesitancy, and nocturia. BPH is an extremely common condition which affects over 200 million men worldwide and around 80% of men 80 years old and older. This means that a large percentage of men have a reduced quality of life from a treatable condition. This is a diagram of the process behind BPH, in which you can see the transitional zone surrounding the urethra, thus painting a better picture of how BPH can affect urinary symptoms. Now, part of our research on Rezum is centered around the ISS System, which stands for the International Prostate Symptom Score. This details how bothersome and prominent the patients find their lower urinary tract symptoms to be. The max score is a 35 with a quality of life score of 6. The higher the total, the worse the patient's symptoms are. Because BPH is a common disease, we have found a variety of strategies to treat it. Some of the most common are alpha-1 blockers and 5-alpha reductase inhibitors. As you can see, the pre- and post-treatment IPSS scores of both alpha-1 blockers and 5-alpha reductase inhibitors decreased by 50% and 20% respectively. However, phosphodiesterase 5 inhibitors only showed a decreasing IPSS of 15%. While these medications are effective in some patients, they may not be as effective in others. They also carry with them side effects, as well as monthly and yearly costs. As with any medication, compliance is another obstacle providers have to deal with. Moving on from pharmacologic treatments, there are several surgical and procedural BPH treatment modalities. The gold standard as of today for treating BPH is that of the transurethral resection of the prostate, also known as TURP. This procedure has been shown to be extremely effective and can reduce patients' IPSS scores by almost 75%. Newer, more minimally invasive procedures, such as aquablation, have shown similar IPSS reductions, thus leading the way for more minimally invasive procedures. So finally, we can talk about what Rezum really is and what it can provide our patients. It is a minimally invasive procedure that utilizes vaporized water to ablate prostatic tissue. These are 5 landmark studies that have shown up to a 60% IPSS score decrease among patients, proving that this procedure is an effective and promising option for the treatment of lower urinary tract symptoms secondary to BPH.
Now we will be talking about the impacts of Rezum at the Medical College of Georgia. We had a total of 37 patients who had undergone Rezum, out of which 26 patients had pre- and post-IPSS scores. The mean age of our patients was almost 74 years old. The average prostate length was almost 3 centimeters long, and our patients had several comorbidities. About 62% of our patients had diagnosed hypertension, about 35% of our patients had diagnosed diabetes, and about 35% of our patients had other neurological diagnoses as well.
Our patients for this study were sick. The list on the screen arose from only a handful of patients. Because of this, the nature of Rezum being a minimally invasive procedure was of extreme importance.
Pre- and post-IPSS scores were on a scale of 0 to 35, and pre- and post-bother scores were on a scale of 0 to 6. We went through several chart reviews for our patients. Of the 37 patients who had undergone Rezum, 30 were called, out of which 21 responded. 5 pre and post were already charted, and 2 patients were deceased. In total, we had 26 patients who had complete pre and post data. Patients responded pretty well to Rezum. IPSS scores fell from 24.88 to 10.92 on a 35-point scale, indicating a 56% drop. Bother scores fell from 5.12 to 2.12 on a 6-point scale, indicating a 59% drop. Most shockingly, catheter use fell from 57% all the way down to 8%, which indicates an 86% resolution of urinary retention that required a catheter. Our statistical analysis showed a mean difference in IPSS scores of 13.96 with a standard deviation of 8.97. This indicates that we are 94% confident that the mean difference in IPSS scores indicates improved urination. The mean difference in bother scores was 3, while the standard deviation in bother scores was a 2.48, indicating that we are 88.7% confident that the mean difference in bother scores indicates improved urination. We would like to expand our patient size to be at least 95% confident that the mean difference in both IPSS and bother scores indicates improved urination. Expanding the number of BPH patients receiving Rezum should help meet this definitive benchmark. In conclusion, despite having some of the sickest patients, Rezum provided our patients with some of the most drastic improvements in urinary function. Although our patients were under monitored anesthesia care, Rezum is a lower risk alternative compared to other procedures as it does not require general anesthesia and can be done under local anesthesia. Nonetheless, we would like to expand our analysis to include more patients, as this is a preliminary trial towards the pursuit of becoming a center of excellence.